We all take motion for granted until suddenly it's gone. Every year, millions of people around the world fall victim to strokes, but current rehabilitation and reimbursement policies have created a gap in therapy for the upper extremities.
In the old days, a patient who suffered a stroke with a hemiplegia would typically stay 2 to 3 months in the hospital. The exact same patient clinically today stays 2 to 3 weeks.
So there's really a dilemma. Do you spend the 3 weeks teaching the daily living skills in a compensatory fashion so that they can leave the hospital able to dress and eat and bathe? Or do you take that time and try to re-educate the arm? It's a tough dilemma.
Now a unique neuromuscular retraining device closes the upper extremity gap. The ReoGo system from Motorika. Therapy with a robotic touch. ReoTherapy enables repetitive, active engagement of arm movements in the patient's full 3D workspace with a range of harnesses, splints, and supports for safety and comfort. Clinical studies show the effectiveness of intense repetitive therapy in stimulating cortical reorganization via neuromuscular training, improving the functional capability of stroke victims.
Now basic science has told us that the brain is capable of reorganizing itself. Science is telling us that there is the potential for improvement on the affected side.
Motor learning requires high repetition and feedback, internal feedback through sensory pathways and external feedback through vision, cueing, coaching.
ReoGo's range of exercises focus on recovery of reaching ability, providing detailed data on arm performance and patient progress, setting new standards for treatment and evaluation. With engaging interactive visual and auditory stimuli, ReoTherapy motivates patients to succeed. It exercises cognitive capabilities along with motor skills, providing a comprehensive personal recovery plan.
The robotic arm gives us an opportunity to explore ways of treating the arm that we've never had before. How do you teach someone to initiate a motion? How do you teach someone to sequence smooth wrist, elbow, shoulder motions? How do you give them lots of variation with lots of repetition?
If a patient can be set up with a machine that will provide the exercise for a long period of time so that the therapist can pay attention to another patient, it increases the efficiency, it increases the productivity of the clinical staff.
ReoGo covers the full continuum of treatment, from acute and post-acute inpatient through outpatient clinics and long-term use at home. Future ReoGo products will provide a comprehensive solution for other areas of functional recovery. The demand for effective stroke therapy is increasing dramatically. ReoTherapy offers the potential for improved patient outcomes and enables practitioners to provide efficient, significantly improved health care.
I think devices like the ReoGo have great potential to be used in all phases of rehabilitation following a stroke.
It'll help us become much more effective at accomplishing goals, and that's always better practice of medicine.
The ReoGo system for neuromuscular retraining. Innovative therapy solutions with a robotic touch. From Motorika.